Hello everyone, I am Dr. Manish Verma, liver transplant surgeon at Apollo Hospitals, Jubilee Hills, Hyderabad. We are making this video because of the many questions that are being asked, especially related to the care of liver transplant patients in the times of this coronavirus epidemic. Now, what we have to understand that this coronavirus is not something which is going to go away over the next 1 or 2 weeks. It is here to stay, and definitely it is going to be there in the community for some time. It will definitely get better, and we all are hoping and expecting that. However, while we are waiting for things to get better, we should not get into more trouble by neglecting the essential health care which is due, which has to be done for all the patients who have undergone a liver transplant. So the most important thing for all our liver transplant recipients is that they should continue with their routine protocols of getting the tests done and consulting their doctors. All of our recipients would have got a schedule which they have to follow, and they have to get tests done on regular intervals. Please go ahead and get those tests done. You can ask the lab people for home collection facilities. A technician can come at home and draw the blood samples, and even the reports can be sent to you in a digital format. Nowadays, majority of the routine follow-ups for transplant patients does not require the patients to come physically to the hospital. So please connect with your transplant team, your transplant surgeon and your transplant coordinators, and find out if there are facilities for an online consultation. At Apollo Hospitals, you can take an appointment with the doctor of your choice at apollo247.com. Now, these online consultations are now a very well established way of doctor-patient interaction. And based on these consultations, if your doctor wants you to come to the hospital, then make all efforts to come to the hospital. However, please avoid routine visits to the hospital, especially if it is not required. So online consultations is the way to go. The second thing is that do not get into trouble because of not taking medicines. Majority of the transplant patients will be on medicines which they will have to take long term. Be very, very sure of what medicines you have to take, when you have to take, and maintain a stock of those medicines. What I suggest, always buy medicines in bulk of 3 months, and when 1 month worth of medicines is left with you, go for the second refill of 3 months. So always maintain a stock of medicines. You should never run out of medicines. This is going to avoid a lot of problems and a lot of visits to the hospital. Suppose in the unfortunate situation wherein you actually fall ill, you start having fever or any other problem. Many people have uncontrolled diabetes. For some people, the blood pressure might shoot up. All these things should not be neglected. A stitch in time saves 9, and this will not be any more true than in the present situation. Be aware of your health situation. If you need to consult a doctor, consult them. Take an online appointment as much as possible, and then treat any problem in time so that the visits to the hospital can be minimized. The other thing which everyone has to do, and I will again reinforce here in front of you, is wearing masks. Whenever you have to venture out of the house, you have to wear a mask. Make sure that the mask covers the nose as well as the mouth. Any visitors to the house have to be discouraged. However, if suppose somebody has to come, make sure that those people also wear masks and they do it in a proper way. Hand hygiene has to be observed strictly. Hand washing with soap is a very effective method of preventing getting the virus infection. So wash hands with soap, use a sanitizer, hand sanitizer which has got some alcohol as frequently as you can, and anytime you touch any surface which is outside of your house, you should use your hand sanitizers. The third and another important thing is about the physical distancing or social distancing that we are talking about. Always maintain 6 feet of distance between people whom you are interacting with, and while you are doing that kind of an interaction, make sure both you and the person in front of you are wearing masks. So these are the things which are going to prevent you from contracting a coronavirus infection. But more importantly, while everyone is talking about coronavirus, and rightly so, you should not neglect the other important things concerning your health. So in these times of coronavirus epidemic, it's important to be safe from coronavirus. But also equally important is to make sure that your routine healthcare continues. Your transplant medicines and the routine tests which have to be done as a part of the transplant follow-up should be diligently followed, and this is going to ensure that your hospital trips are to minimum and you stay happy and healthy. For any queries or consultations, you can reach out to me at apollo247.com, or you can contact us on our liver helpline, which is 9704 688 300. Stay happy, stay safe.
Thanks for watching this video. Like and subscribe for more videos.